The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited to have with me on the program today Shelly VanEpps. Let me first hold on, Shelly, just a second, because I know you've got some awesome stuff to go over. But I just wanted to say Shelly's an amazing person in the dental industry, a ton of practice experience. She's one of the coaches at All-Star Dental Academy, which is a great organization that we work with, that we do a lot with. Excited to have you here. Thanks for coming back.
Thanks for having me. I appreciate it. We have an
and
exciting topic to talk about today.
exciting in a good way and a bad way. You've got some solutions, which is awesome. We're going to have a download that's going to go with this. You're going to want to check it out. You know, this actual issue is hush hush, and it hasn't affected all practices, but a significant amount of practices are affected by this. So stay tuned. But Shelly, first of all, tell me a little bit about yourself, a minute or less, experience in dental, and then take a couple of minutes and talk to us about All-Star Dental Academy and what you're doing there.
Yeah, absolutely. I am Shelly VanEpps. I'm the VP of Business Development and a mastery coach with All-Star. Like you've said, Patrick, I have a lot of years of dental experience, and I'm super excited to be partnering and being part of All-Star Dental Academy, partly because it just stands for so much that I feel was missing to some extent in the dental world, and that is supporting the teams, making sure that we have strong communication skills, training systems that are in place for your teams to make everybody as strong as we possibly can for ultimately the betterment of our patients.
Yeah.
And that's what it's really all about. And that strengthens the practices and makes the doctors happy, right? So
yeah, and it's awesome. And I love what you guys are doing. I want to invite people to check out your website, the All-Star Dental Academy website. You had a great program, a lot of training, really amazing price as far as I'm concerned. The value is 100x the price. So check it out. It's really low cost, low commitment. So check that out. Let's jump into our topic today. So, you know, and this is one of the things when you have great coaching, when you have a great team, you can be out in front of. Reacting to problems is always difficult. Reacting to problems and coming up with a good plan weeks or months later is even harder. So you want to avoid that. And you've come up with a solution for this problem. Well, let's talk about it. It's insurance companies, hacks, billing, office managers that have about as much hair as I do now. Easy. And you guys have got a fix for this, right? That can help people actually sleep. So first of all, let's talk about the problem. What is it?
Yeah. So back in February, as most of you are well aware, the dental or the healthcare exchange was hacked. And it has impacted practices greatly, whether you're fee for service or just out of network or in network, it is impacting these offices. And we thought it would go by fairly quickly. And what we're finding now, a month and a half later, is these practices are suffering. And they're suffering in their sanity as well as financial health. Right. And so in talking to offices and coaching them, and hearing the different, what do I want to call it? The panic, I guess, in some of their voices, we thought, we have resources. We have a whole team of coaches. Let's put our minds together. Let's put together a resource for these offices where they can read through it, start implementing right away, and hopefully rebound significantly quicker. And then more importantly, protect themselves from having this happen to them again in the future, where they're having to figure out how to collect all of a sudden.
Yep. So there's a download again. You can find it on our website, your website, social. It's everywhere. You can't miss it. We'll make sure that talk a little bit about this download or talk about the process and helping people get control of this and master it.
Yeah, the first issue is that claims aren't going through. We know that electronically, there's only one, maybe two clearinghouses that weren't impacted. So for the most part, claims just aren't going electronically anymore. And so we have some solutions, different ways to get these claims in the hands of the insurance companies. But even those that are getting in their hands, they're being significantly delayed because now the insurance companies are backed up because of the whole issue. And so that's why even if you're fee for service, it's still impacting, maybe not your practice, it's impacting your patient. They're going to have a delay on their reimbursement. Right. And so it's really important to have some different options in place.
And for that fee for service practice, the patients always blame the insurance company, right? They never blame the dental
Oh,
practice.
yeah, sure. It's not because we didn't delay. It's always the insurance.
Yeah,
Not.
yeah, that's right. So we all know how that goes, but it's perception is reality, right? So
Right. So
you're paying.
strong communication, setting the standard, letting them know, hey, the insurance company has been affected by some different things that have been going on. Just be prepared that your claim may not process as promptly as it may have in the past.
Yeah,
Just that simple verbiage of communicating with your patients. Set
yeah,
the standard, set the expectation.
yeah. So we're gonna talk about 4 steps here that like you should take, like what you should do. I'm gonna tell you first step number 1, get the download. Start there, get it. It's a short podcast, as everybody knows, so we can't go over all of this during the podcast. You can always reach out to the team at All Star Dental Academy, and they will be glad to help out. Shelly is a great resource, and the team there is as well. Get the download. So let's start with step number 2. Your step number 1, my step number 2 is
For me, read the book and then start to implement. What
yeah.
is your step number 2?
Well, I'm just saying step number 1 is get the download, read it. But like, what are some things right now? If you're not that person, what should you do? If you can't get
Oh, okay, yes.
the
So
island
start
without a
seeking different ways to get the claims in the hands of your insurance company, but
yeah,
also communicating with your patients, making sure to set the standard and let them know exactly what's happening. So
yeah,
there are different ways. You can snail mail them. Is that the fastest way to get them processed? No.
yeah,
That's why we all shifted gears a long time ago and we don't use snail mail anymore, but it is an option and
sure,
something that I don't think that people should just tuck behind them and say, I'll just wait for this to get up and going again.
yep,
We're 6 weeks in, 6, 7, it's growing. I
yeah,
mean, by the time you watch this podcast, you could be 2, 3 months in, right?
yeah,
And it's not getting any better anytime soon at this point. So,
yeah. So step 1, download. Step 2, communicate with your patients.
yes.
Step 3, make sure you get those claims in front of the insurance company. Snail mails one way. What's another way that you get them in front of
You could email, you could fax, you could go on their online portals, you can enter your claims manually. Again, just remember this is an increase in our manual labor
them? Yeah,
at the front desk. And so I say that so that doctors realize and team members realize this is going to be some sweat equity to get us out of this situation.
yeah,
It's going to take some hands-on to be able to make it. We used to be able to hit a button and whoosh, it's gone.
yeah.
That's not going to be the case right now.
How do you manage this in your practice? Does it mean cutting back on the amount of patients that you're seeing for a little bit while you get caught up in this? That seems like a no-no.
No, we don't want to do that. That's why in the ebook, there's actually a process and we lay out, time management. What is the best time of day to try to do some of these things? Is it best to
Mm,
have a team effort? Is it best to have one specific person assigned to these tasks?
yeah,
Is it a good idea to outsource it? And see if you can find another company that can help partner with you to get these claims out into the insurance companies.
sure.
And then we have to make sure we're following up. And we used to be able to wait a little while before we checked on the status of claims. We really can't do that anymore. We really have to at least make sure they have it in their system and that they're in process and
Yeah,
document that we
yeah.
know they have it.
Let me ask you this question, and it might seem silly to you. I know some dentists are wondering this question. Is there a dollar amount compared to what your annual collections are that if you're under that dollar amount, you should just walk away from it? Go forget it. It's not worth it, right? Because we do get to a point with everything where we just want to throw up our hands. Is there a point where you're like, yeah, it just makes sense to not invest in this?
I have not seen a practice get to that stage yet.
No.
I feel like if you want to remain in practice and you want to remain a dentist and you want to stay with your business, stay with your
Sure.
practice, your patients, take care of your patients, there are solutions. At least try some of these things.
Yeah.
Try to rebound, try to pull back, try to increase your collections and dig your way back out. The name of the ebook, Keep Calm and Keep Collecting. That's what
Yeah.
it's all about. If you panic, it's going to be worse. And if you panic, your team will panic. And so just remember that, stay calm, take a look at the different tips and tricks, start applying them, maybe not all at the exact same time, because then your team will become overwhelmed very quickly. But read through, see what you're not doing yet, and pick and choose a few things to start bouncing back.
Yep. Awesome. Makes sense to me. Shelly, to learn more about All Star Dental Academy, what should we do?
we should go to allstardentalacademy.com to get the ebook, do a / keep collecting. And if you want more information about All Star in general, feel free to reach out to me or Heather. It's our first name at allstardentalacademy.com. So
Awesome.
Shelly at allstardentalacademy.com or Heather at allstardentalacademy.com.
Awesome. Thanks for providing the information, the free download. Thanks for all that you do in the community and helping dentists and practice owners across the country. We appreciate
Absolutely.
it.
It's our pleasure. Thank you for having us.